So one of the things we like to think is it's easy to conceptualize the health system, to think about the health system as a kind of linear system. Kind of like, if I do X, I will get Y. And anybody who's navigated the system with a loved one with a rare disease knows immediately that's not the way the system works.
As an organisation and as the people who are going to be speaking up, it's those that probably have the capacity to do that, to advocate for themselves. And there's a real need to support and advocate those that are going to go through this transition that don't know what might be available to them or how to speak up for their own needs as well.
The Commonwealth Department of Health will monitor then not only the creation of transition plans and ensure that all people with rare diseases are getting these created for them, but also how well that they are actually then implemented. Because we think at the moment there might be some implementation challenges. The transition plan is good, but potentially it doesn't get followed through. We also realise that we don't have all the answers yet. So we'd like to announce a funding call for projects through the MRFF to improve our understanding of the gaps today and co-design solutions with consumers and other stakeholders for new ways that we can address the challenges of transition for young people with rare diseases.
We needed to create a special workforce, and it sounds like the specialists also think so, where there's GPs who are essentially ambassadors in rare disease. And so they're responsible for training, upskilling, and getting all of the extra resources, networks, and pathways to look after individuals with special needs. And the PHN will be responsible for rolling out those programs. And we'd be also empowering patients to look to these doctors to build relationships with them early. So we didn't have that problem where we'd get to transition and we'd ask them, who's your GP? And they wouldn't even have somebody because it'd be their paediatrician who did everything for them. So this idea around sort of national campaign around rare disease, get to know your GP for transition.
And so we think this nicely captures what many people experience as they go through the system, even just getting ordinary care, let alone trying to get care for a rare disease.